Hello, everyone. It's Friday, July the 10th. I'm going to start off with something that I'm absolutely delighted over. We do not have an additional death. Since Wednesday we had no additional deaths. We have not had an additional death in West Virginia since Monday. That's great. And I urge everyone again, we've lost 95 people. It's always 95 too many. And we surely need to remember those and keep them in our thoughts and prayers and be very prayerful that some way, somehow, there won't continue to be more. I want to go over just a few numbers with you, and I'll go over them very quickly, but we had another 60,000 plus cases in the U.S., a new record in the last 24 hours. In West Virginia, we had 130 new cases. Our daily rate was at 3.86. Just remember that we had many daily rates that dropped below 0.5%. 3.86 is not where we want to be. We have the highest number of active cases in West Virginia today that we've had in 1,074 cases. This is an increase of 437 active cases since last Friday. Our RT number is at 1.36 in West Virginia, and that is the second highest in the United States. Our hospitals are still in great shape. We only have 50 people that are hospitalized right now. All of us know that there could be a hot spot at anywhere, and today that hot spot is no question but in Mullen County. We have 246 active cases in Mullen County and well over 400 that are positive cases that we have accumulated in Mullen County. Now, if I could just talk to you just 1 second about Mullen County, and it's just this. We need to understand that my executive order said mandatory. Mandatory in public buildings. Now that public buildings is churches, it's mandatory to wear masks. Now, we have held the reins back as far as making some kind of penalties or whatever it may be, and we don't want to drive ourselves into a situation to where we're divided in more of a stringent way. I trust West Virginians. I trust you to be honorable, really, really good people. And I know you are. And I know at the same time what we have got to do, and we've got to do it now. The other day we made it mandatory. We're making great strides. If you go in a Walmart or a store, you see it, and you see it all over the place. People are doing a lot better. But we need to be almost flawless. 80% is what we surely have to have, but we want to be 99.9. And if Cousin Eddie doesn't want to wear a mask and everything, some way somebody's going to have to convince Cousin Eddie to wear a mask too. Now, I'm surely not being derogatory towards anyone that believes it's not their right to wear a mask, but I am pleading with them to tell them that in this situation, absolutely we're going to have more people get sick and more people die. And it is an inconvenience that is so minuscule that please wear your mask. Now, as far as Mullen County goes, what we have to do is just this. We have to be looking now at closing the bars. We have to be looking now at closing indoor dining unless we get a real movement and moving in our direction. It's the last thing we want to do. The very last thing we want to do. We're going to have to look at restricting our gatherings and going to a smaller number statewide. In Mullen County, we are looking, and I'm waiting on more information coming from our experts and everything to tell us go now, shut the bars back down, shut down the indoor dining. Do you think we want to do this? It is the last thing on earth I want to do. But especially in Mon County, but especially all over this state, we have got to absolutely wear our mask. You see, at the end of the day, this is the only bullet that I've got right now. The next bullet that is available is shut our state back down. This is the only bullet that I have right now to do something other than to shut our state back down. So I need you. I need you, West Virginia, and I need you right now. Now, along those lines, just look at this right here just for a second. In the state of Mississippi, where many lawmakers absolutely decided upon themselves they weren't going to wear a mask, I think the number now is 1 in 6 lawmakers has the virus. It is absolutely imperative that we wear a mask. Now, I want to jump to a few things, and I'll jump pretty quickly here now, but on our small business grants, you know, you're going to now see that we're going to have you start applying, you know, that you're a West Virginia vendor, and then in addition to that, supplying us with bank account information, and then we're going to have more detailed, an app come up on Monday of exactly how you can apply to where we can start getting the money and getting the money out to our small businesses as fast as we possibly can. I want to remind everybody that now we've backed up a little bit and we've dropped the number of employees from 5 to 1. So any of our small businesses that have 1 to 35 employees can qualify. And we're going to start out by sending everybody $5,000. And then as we have dollars left over, we'll back up and send those dollars out as well, up to $150 million. I want to make an adjustment on our CARES Act funding. And we've been working this, and we've really been working this a lot, because there is one area that we want badly to get money to, and that's broadband. Now, in doing so, I've met several different times with the legislatures, and they have some really good input, and I appreciate the input that they've given me. And here's what we've done. We've gone back to the highway department, and we've said, do you need the whole $100 million tomorrow? And they said, no, we don't need the $100 million tomorrow and everything. And what we can maybe do is phase this in. So now what we're going to do is we're going to change and pivot. And we have 2 major broadband announcements that are going to come, and they're going to come on very, very, very soon. But what we're going to do, we're going to pump $50 million of our CARES money over into broadband. And what we're going to do there, and then what we're going to do is we're going to phase our highways in. And if we're going to use 50 now, and as we go forward and everything, if we have more monies available, then we can backfill the 50 that we're losing over on the broadband side. Now, the broadband side is going to be primarily for, distance education, telehealth, all kinds of things like that make us able to qualify under the CARES Act provisions. Okay, I remind everybody on top of all that to please know just this. There are the grants that are out there. There's $970 million in those grants. Work the grants. See where you can qualify for dollars that we can pull out of this grant money. It's really important in everything, and because we want those dollars flowing to West Virginia. Any dollars that we can pull out that are flowing to West Virginia are making more and more good things happen in West Virginia. Today I'm announcing something as an appointment that is absolutely, I am tickled to death, because now we have got, not to slight anyone of the past and everything, but now we have picked up an incredible West Virginian. And today I am announcing that doctor, and it's pronounced Ayn, spelled A-Y-N-E, Amjad, is taking our position. She's a physician in the Beckley area. I've known of her work on and on and on. She is absolutely a star beyond belief. She is going to be taking, our position as our head health officer in West Virginia and the commissioner of the Bureau for Public Health. And so I could not be any happier. She is a practicing medical doctor in Beckley, specializing in internal medicine, and she also has a master's in public health. I mean, she has done so much stuff. She has an incredible resume, and she is excited about being a part of this team. And there's not very often are we able to reach out and really snag a real superstar, but she is just that. She's a Marshall graduate. She's MD. I mean, you'll hear from her in just a few minutes, but boy, we're really, really proud to have her. That's for sure. And she comes. You talk about wading in to the pool when there's a lot of activity going on there. There's a lot of activity going on right now, and it's activity that's going the wrong way, and I'm sure she'll be a tremendous, tremendous help. I'm going to go through these real fast now. Our free testing, we're going to be up July 10th and the 11th in Mercer, Upshur, Mon County, Marshall County, Preston, and Wayne counties. Again, we go on and on and on. We're going to be up next Tuesday, Thursday, and Friday in Harrison, Barber, and Mercer counties. We missed some people the last go around in Harrison. I salute our National Guard and all those that are really working this really hard, DHHR and everything, to get back to Harrison County. That's really good. So go get tested. It's free, especially our minorities show up. The more information we have, the better off we'll be. We have now tested in West Virginia 199,383 people. We are pacing, right with now the national testing average and significantly above all of our neighbors, whether it be Virginia and Pennsylvania, Ohio, Maryland, Kentucky. So keep going and getting tested, West Virginia. The more we test, the more we know. We've now sent out $38 million to our cities and counties. We have awarded $38 million to our cities and our counties, and those dollars are going out. I just got off the phone with our state auditor. J.B. McCuskey, and J.B.'s doing an incredible job, and I appreciate all he's doing and all the great people that work over there and how they're helping us get this money out and everything is really, really, really important, and so I really appreciate them. We've only heard from 143 cities and counties so far. There's a lot of cities and counties we don't have apps on yet. We encourage everybody to do so and get those apps into us as quickly as you can. Our summer feeding program, now we're up to 690 sites from 670. We're trying to make sure that everybody in this great state is fed and nobody's going hungry. So please, see the maps, follow the guide, follow the website, and if you need help, call 211 and we'll get all the help to you, and we'll get it to you as quickly as we possibly can. Now, last thing I have is the census, and then I'm going to turn this over to the head of our SSAC, Bernie Dolan, and Bernie does a fabulous job as all those people with the SSAC. Bernie's going to give you a whole bunch of information in regard to sports. When I came today, and I'm coming right into the Capitol, there's probably, there may be 60 or 70 kids out there. And those kids are there saying that we want to be able to play. They want sports in the schools. Well, there's nobody that wants sports to be going on more than this gentleman that I'm going to turn over to you in just 1 second, nor myself. We want to protect all those that are, in school, and we absolutely want our kids back in school. We want to do it in a way that is absolutely where we know that it is as safe as we can possibly make it for our students, as well as our teachers and all those that are there working with those kids from service personnel right on down. Now, in doing so, Bernie and I surely recognize the importance of sports. You know, sports give us so much. They really give us so much. And at the end of the day, they teach us so many life lessons. And just to tell it like it is, sports are an enabler in a lot of ways that it helps us to retain and keep kids that we may very well lose if we didn't have them. They're important to our communities, and we love them in every way, and they bring us together, and it means so much. So in doing so, we all know that we may have to change, and we may have to change again. We don't know what this is going to do. There is no playbook here. We do not know what this is going to do. We hope and pray that we'll be ready to go, and we've got to have plans. We've got to have a plan of what we're going to be able to do. Today, we have a lot of concern all over our state. And today, that's why the other day we moved the date back to September the 8th. September the 8th, we'll go back to school. We moved a lot of school calendars, and Clayton Birch, who's doing a fabulous job, is really working with all these superintendents, and we're going to get that done. Now, but we've also got to address, what are we going to do with football? What are we going to do with soccer? What are we going to do with volleyball? What are we going to do? You know, because we want our kids to do that as well, if we can. So before I turn this over, I'm going to just emphasize, if we can. We're going to do it safely, and we're going to do it right. We're going to protect our kids. We're going to protect our kids in every way, and we're going to protect all those that are working with our kids. But we're going to be ready. We're going to be ready, and let's hope and pray we can go. And so I'm going to turn over now to Mr. Bernie Dolan. And Bernie, you take over and tell them of our schedule and all the good things that we've been working on.
Okay. Thank you, Governor, and good afternoon. We all know that athletics play an important role in all of our lives, whether you be a student athlete or a parent or just a fan. It's our role as the West Virginia Secondary School Activities Commission to develop plans for safety and to allow the games to be played and the practice. It's not unusual for us to have restrictions and guidelines for the schools and the teams to follow. We look at this as just another one of those things that we're doing to enable us to be able to participate safely. You know, you can call him governor today, but in the winter he's also coach, and you know, Coach Justice doesn't like to lose, and certainly not being able to participate certainly has played hard with him too. With that, I'd like to announce that, you know, we have, because we've moved back the start of school to September 8th, we also are pushing back our practice days. So instead of starting on August 3rd, which most fall sports would have started besides volleyball, we're moving the start of all of our practice activities to August 17th. That will coincide, as the governor talked on Wednesday, that he was hoping that we could move a football game so that the start would be right before, the week before we come back to school. So as we work from there, we work backwards because you have to have so many practices. You have to have 14 practices to safely participate. So we had to get to a starting date that allowed us to have that. With that being said, golf has the least number of days required to practice in order to participate, and they can socially distance better than any other sport. And so our start date for golf practice is August 17th. Their first contest will be August 24th. And so they'll have about a week of practice. It allows them to get back outside and start doing the things that they like to do. On September 2nd, we are opening up competitions for volleyball, cheer, cross country, and soccer. And all of those are a week or so later than their normal time. They all have the flexibility to change their schedules, and therefore, instead of playing one game a week or two, you might have to squeeze in a third in order to get all your games. Football, we allow football to start on a Thursday night, so we will be allowing football to be played September 3rd, is the Thursday night prior to that first week of school. We think it's a great way to bring the community back together. Everybody will be in full swing by the time we walk into school on that next Tuesday. We think it's a great opportunity for our kids and for our schools to be the center of their community again and be the hub and drive what goes on in their community. So as we move forward, you know, as the governor said, this changes from time to time. In the spring, we had different schedules trying to get the tournaments in. You can bet there's two people up here, up front, that are going to do everything we can safely to allow athletics to continue, because we know it's such an important part in the growth of our students, both physically, socially, and emotionally. You know, we brought them back 4 weeks ago and let them start meeting with their coaches again. We limited it to an hour. Just the ability to get back and see your coach and be able to talk to your friends again in a structured, relaxed environment. All the coaches that commented back to me and the players that you saw tweeting and on social media, they were just excited to be back. And then the second 2 weeks, you allowed it to extend. They could build a little bit more, get in better condition. And then this past week, we've been able to start our 3-week window, which you're allowed to actually practice with some limitations. And we've had great opportunities for our kids. They're excited. We're going to allow the 3-week window to play out, whether yours started this past week or it starts next week. You'll be able to finish that under our current guidelines. Most of our activities are outside, and you can socially distance pretty easy. And then there'll be a break before we start our August 17th start of our practices again. So it'll give the kids a time to relax and then to get back in condition and allow everybody to regroup. So with that, you know, Governor, we'll be releasing these things both on social media and to all of our principals, ADs, superintendents, and obviously to the media.
Tell them about social distancing at the games.
You know, right now we have, you know, if you can't be, you have to wear a mask. And I think you're going to need to be socially distant and wear a mask, especially indoors and outdoors, anytime you can't do that. And I tell people, it's up to the public to decide whether or not we're going to have athletics come this fall, because you're the one who will wear the mask and take the social distancing and wash your hands. It sounds like it's an easy thing to do for everybody to get on board. So if you're the one who's not socially distancing, not wearing a mask, you very well could be the one. You're setting an example to somebody not to follow, and then that hurts all of our chances of participating. So we will be asking you to social distance. We'll probably have limitations on attendance. We haven't set what those are, and I'm sure they may vary from community to community and from sport to sport. But we ask you, as the community, if you want this, you have easy things to do. You could be a good role model and do it. And follow, put your mask on when you're in public. I know it's annoying, I know it's uncomfortable, but everybody felt what happened in the spring. Nobody liked no athletics. Everybody was frustrated. So to me, it's a small task to say, be a good role model, wear your mask when you're in public, socially distance. We'll be putting out guidelines with the Department of Ed and with the Department of Health as to what the standard is going to be at each game. Each venue has different opportunity for social distancing, and we just hope that we know that everybody wants athletics. We know it's important. We want you to do your part to help it come to fruition.
Well, Bernie, listen, thank you so much, and y'all, everybody heard, you know, from the man there, and what a wonderful job all of them are doing. You know how much they want all of us to be able to have athletics and all the goodness that athletics brings to each and every one of our communities and our kids. You know, all of us want just that. We're going to do it, and we're going to protect our kids and protect all those that are working with our kids. But you know, we need all of you. The bottom line is just this. You know, I've said it until I'm blue-green, but if you'll wear a mask, not only will you protect yourself, but more than anything, you're protecting others. And as you do that, just like, you know, Mr. Dolan just said to us, just think about this. Just think for just 1 second. You're setting an example. You're putting a stake in the sand that says, this is what we should do in our communities. You're setting an example that absolutely our kids and everybody will learn from. And so please do this. We're going to be all right and everything, but we need you. We really need you really badly right now. It's anything bad, but I've got to tell you this, that just in a few days, next Wednesday is the 15th of July. The dreaded April 15th filing date that all of us kind of dread or do dread in a lot of ways, the filing date on our income tax returns, we moved to July 15th. So we absolutely urge you to get those returns in, and if you have any questions, please contact our state income tax department, and our stuff is up on the website and everything, and so call us if you need us and everything, but and we'll help you through that. But nevertheless, the only other thing I have is just this. I always talk to you about our you know, charts and everything. And if you could put those up real quick, Jordan, you'll see that big bulge in the top chart and everything of recovered cases to active cases. And the bulge was going just the way we wanted it to go. And now you see it narrowing. Well, that's not what we want to do. And that's the number of recovered on the top and the number of active on the bottom, and we do not want them coming closer together, but they are. And then you'll see down at the bottom, you'll see our daily positive, or not at the bottom, in the middle, our daily positive number. I've already told you that our daily positive today was 3.86. It's way, way, way too high. And then you'll see our cumulative down on the very bottom, and which way is it going? It's going up, and that's not good either. I've already mentioned our RT number, and that number we're the second highest in the nation on a population basis. It's not good. I've warned you many, many, many times, and I've told you mathematically how we could end up being Texas. We're the most vulnerable. We have the most chronic illnesses. We're the oldest. We're sitting right in the sweet spot. We don't have an ocean 2/3 the way around us like Texas does. I mean, for crying out loud, absolutely, we have got to know just how much peril there could be right here in West Virginia. The only bullet in the gun right now is this right here, this little mask. And the last thing I would tell you is just this. As I mentioned earlier in regard to small businesses, we probably are going to have 30-odd thousand small businesses in the state of West Virginia apply. Those guidelines will be up this evening. They are not up yet. They will be up this evening, and they'll tell you and direct you how to apply. There's more work going on right now with the auditor's department and everything. We're working it and everything to be able to make this as efficiently as we possibly can to get you those monies out and get those monies out quickly, because we know we've got small businesses out there that are really hurting, and this is our way to backfill as best we possibly can. And the last thing we got to do, we got to try to some way protect ourselves as best we can against fraud. And that, you saw what happened, with the unemployment claims and everything, how that is always on everybody's mind. So we're going to try as best we can to protect ourselves on that. We're going to try first and foremost to get the money out the door and get it out the door to our small businesses. But that's all I have. Thank you all so much.
All right, thank you, Governor. Now we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and I want to welcome Ayn to the team. We're really fortunate to have somebody of her quality help with the oversight of the public health of our state, and certainly during this pandemic. I want to reinforce a couple things the governor said and even update something. So during the governor's comments, the RT value in the country updated with today's data. And we have moved, unfortunately, from number 2 to number 1. We now have the highest RT number in the country. We are at 1.37, which suggests that at least per that calculation, the virus is spreading faster person to person in West Virginia right now than any other state in the country. And take that into consideration when you look at Florida, where in Dade County, 33% of people that are being tested for COVID are positive. And as we talked about the last press briefing, it took 99 days in the US to reach 1 million people COVID positive. It took an additional 43 days to have 2 million people be COVID positive. And then in just 28 more days, 3 million people became COVID positive. So we can see that COVID is starting in that logarithmic phase, that compounding phase. And we're seeing some activities in the states that the governor mentioned, for instance, in Florida, where 55 hospitals have run out of ICU capacity. And many people might say, well, we still look okay. Our deaths are still only 95. And while that's 95 West Virginians that have died, if you look across the country, that's still very, very good. But we know that the RT values and seeing more cases, and the governor said earlier that we have more active cases today than we've had ever since the pandemic has started. And by my calculation, in the last 10 days to 2 weeks, we've about doubled the number of active cases. But we know there's about a 2 to 3 week lag. And when we start seeing a lot of activity and seeing the virus start to spread much more rapidly, and then when we see people getting really sick, and we see hospitals starting to see more people with COVID and ICUs seeing more people with COVID. So I'm not saying that to scare anybody, and this is not unexpected. Unfortunately, as we've said, COVID is a pandemic. No place is spared. Every place is susceptible. And given that West Virginia is more rural in many ways, we know that the second part of COVID is more likely to have an impact on us. But it is really critical that we mitigate very aggressively today. In the initial phase, we know that if we don't do things today, 12 days later, we're likely to see a significant uptick in the people that are sick and how sick they are. And just as a reminder, and the governor did this too, a mask works very effectively if everybody wears one, in reducing the droplets and reducing the spread. But it's really important that people realize a mask is not a substitute for physical distancing, particularly if we're inside and around other people, or as Bernie Dolan said, outside at a game, and we hope we can get back there. It works in concert with that. So a mask plus social distancing or physical distancing is better than either alone. And remember, when you put on your mask, put it on, make sure it covers your nose or your mouth. and then tighten this around your nose and the top part of your face so it fits snugly. And if you do this, and while it may be a minor inconvenience and it may not have people feel as comfortable, this is something we're doing for each other so that we control the rate of spread of the COVID virus to protect our vulnerable citizens, to protect our healthcare assets. Remember, the mortality rate around the world, 1 to 3% when your healthcare system's working well, 5% or more when it's not. And while we don't see those problems now, we want to invest in not only having the liberties, the sports, the businesses, all those things that we love to do together, but we want to make sure that we don't have people die, because COVID is now starting to accelerate its person-to-person spread in the state of West Virginia. As the governor said, it's about us staying together and about us caring about each other and our neighbors that have allowed us to do so well to date. But now's the time that all of us are calling on each citizen to make sure that we are doubling our efforts to protect ourselves and to protect each other. It is a very critical time for our future and for the future of the health of this state. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Ayn Amjad, our new State Health Officer.
Good afternoon, everyone. I am very pleased to introduce Dr. Amjad to the role of Commissioner of the Bureau for Public Health and as the State Health Officer. It's a critically important role in DHHR, and we are certainly happy to have her. That appointment is effective immediately. Dr. Amjad has worked out her situation to begin to help us with this pandemic. We welcome her with her broad experience and her MPH in Masters in Public Health is very beneficial to this. So with that, I'll let Dr. Amjad say a few words. Welcome.
Thank you. Thank you, Secretary Crouch and Governor Justice. And I am excited to be here, and everything happened really fast, but I'm excited to be part of the team, and we'll get started right away to address everything that needs to be done. But today's my first day, and excited to be here with everyone, and we'll see how we can get things started. But today's my first day and get things rolling. But I thank everyone for welcoming me and see how we get things going. But thank you very much for having me.
All right, thank you both. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard also welcomes Dr. Amjad to part of the effort here going forward. Busy weekend with test sites, as the governor mentioned, in Marshall, Wayne, Preston, and Monongalia counties. A lot of effort on behalf of the Guard, DHHR, and our local health partners to get those test lanes running in pretty heated times related to temperatures. Want to talk a little bit about PPE. I know folks are seeing a lot of national media related to PPE shortages beginning to develop again. Early on in the pandemic, Governor Justice directed us to stand up a task force to work diligently to address PPE matters. We continue to work to attempt to maintain a 6-month supply of PPE in the event of a significant surge. There are some areas where we need to continue to focus, including gloves and N95 masks. We continue to work hard on those, but those are becoming national issues or continue to be national issues. I also want to talk about the value and reinforce what the governor's talked about the value of PPE and testing. National Guard has to be ready at any given time, and the state of West Virginia expects us to be there. So we have put a particular emphasis on health of force and testing and PPE use in our force. As some of you have seen over the last couple of days, reporting about National Guardsmen testing positive at the food bank, where we were providing significant support to the food bank. Good news is, with aggressive testing, we identified positive cases. The service members had been wearing their PPE and were effectively socially distancing. In addition, we've had some positives in our force and our regular full-time force that we've identified due to aggressive testing on our part, directed by the governor to make sure that we maintain the health of our force for both our military mission as well as our support mission to the state of West Virginia. Again, those members have been isolated, and because of PPE and other social distancing, we have been able to be aggressive in addressing the positives we do have, as well as making sure that it has had little to no impact on our force going forward. I bring this to everybody's attention because of the significance of what it lays out to all of us of West Virginians about aggressive testing and effectively wearing PPE, not just to maintain our own health, but the health of others going forward. So again, I ask all of us to pay attention to the things that we must do to continue to reduce and mitigate the spread of this virus going forward. Also want to mention that we began to work with county school boards related to the things that they need in the way of subject matter expertise as we do move forward with the potential opening of school coming up here in the near future. Also want to thank those who have helped us as we've been aggressive in our testing with our force here at our headquarters. Dr. Young and the folks from Kanawha County Public Health, as well as local lab, Q Labs, have done some extra work on our behalf to make sure that we can maintain the health of our force in the National Guard. Thank you.
All right, thank you, General. Next, we'll go to questions from media members. The first today is from Steve Adams with Ogden Newspapers.
Yes, this is Steve Adams of Ogden Newspapers, and this is a question for the governor. And I feel like I ask this every about month and a half, but I'm going to ask it again. In regards to the West Virginia legislature, obviously they last met on March 8th. I know you've talked to various members of the legislature, particularly Republican leaders, through this process, but for the most part, this has been done through executive order and through the powers that you have through the state of emergency powers. Some lawmakers would like to be more involved, and I don't mean just phone calls, but I mean actually involved in a legislative way. And I would just be curious, what's the harm in having a special session, considering that last year we were in special session for more than half a year on the education reform bill? They were able to meet, they were able to recess and come back when needed, so they weren't wasting taxpayer dollars. What's the harm in doing that again and having actual legislative sort of checks and balances on what's going on? What are your thoughts on that? Thank you.
Well, Steve, my thoughts are really, really simple. You know, all of us in the governor's office stand with our doors completely wide open to discuss any of the details on anything we're doing. We want to be completely transparent. On the other hand, these powers under an emergency situation are powers that I am supposed to be directing and doing. Not on the grants. There's $970 million, half of the dollars in regard to the grants. You know, but on the CARES money, that's the money that I am supposed to be administering and looking after, you know, and making recommendations and doing exactly that. Now, Steve, you and I both know just this. You got to get money out the door. You got to comply with all kinds of different guidelines. There's discussion after discussion going on with me and the president's office and all kinds of different things that are happening all across our country. You can't possibly be naive enough to know that how in the world do you think that things happened to where every state in this country got a minimum of $1.25 billion? You know, there is all kinds of recommendations. Now, it's not that I can take credit for that wholeheartedly, but I surely, strongly made the recommendation that there was a minimum amount of dollars that came to each and every state, knowing that our state, not having a big population and everything else like this, could very well benefit significantly from that. And lo and behold, we have. Now, I would challenge anybody and everybody to look at how that I have set out to administer those dollars. If anyone can find a fallacy in what I'm doing, I'd welcome it and welcome it tomorrow. Just a few minutes ago, I met with another legislature, the finance chair in the Senate and everything, and discussed all kinds of different things. I am absolutely open to talk all the time, but Steve, I got a lot to do here. I got a lot to do to try to take care of people, and I've not put out there a bunch of my pet projects per se that a bunch of politicians would do or like to do. I put out there $200 million for our cities and counties, $150 million for our small businesses, protect us against having to raise taxes on unemployment. Absolutely, I put out there exactly what needed to be done. And that's my job. That's my job. You and I both know just this. I welcome all the input in the world. But calling people back into a special session to do what I have already done in my job, and I challenge you, find where I have not done something correctly. Absolutely calling everybody back into a special session down here and making it an absolute soapbox show where everybody's trying to claim something for their own pet project and everything. Before you know it, it becomes a political nightmare. We don't need that right now. We've got people dying. We've got absolute decisions that have to be made. And we've got to move this state forward in a prudent way. And that's exactly what I'm doing. I am not opposed to the process of all the checks and balances that there could possibly be. But in this situation right here, under the emergency that we're under, and under the gun that people are genuinely dying, we do not have time for a political circus to happen and happen right here and be able to try to tend to that while we're trying to tend to the people. And so that's why I'm doing, and that's why I'm opposed to that.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS.
Thank you. This is Kenny Bass with Channel 8 and Fox 11. Governor, since we're focusing on sports, at least a part of this briefing, my question revolves around sports. If looking at the landscape today, and if things don't change greatly between now and the scheduled start of practice and games, can we realistically put football players and athletes onto fields in an atmosphere that we're experiencing right now? The NFL wants to try it. The NBA wants to try it. The National Hockey League, Major League Baseball, they're all wanting to try it. Colleges across the country, and yet we're seeing positive test results from each league and from colleges every day. 5 athletes here, 9 athletes here, et cetera. Under what scenario do you think it would be safe and prudent to put athletes back on the field in the fall? Do things have to markedly improve? Or could we do it, say, today if the calendar said September 8th? Thank you.
Kenny, I'm going to defer to our head of our SSAC and have him have some input into this. But before I go there, I want to just tell you just this. If you were to ask me, because you asked several parts of questions here, if you were to ask me, could we go today? If today were September the 8th, I'd say no. Now, I couldn't be any more blunt. I would say no. But at the same time, you've got to have a plan, don't you? And you got to let everybody know just how important that we know athletics are to our kids and to our communities and everything. Absolutely, we've got to have a plan. And we're all very, very hopeful that with a plan, with our medical experts that are all around us, with great work the SSAC does, and the ability to social distance and be able to have it and do stuff. I think one thing I don't know that Bernie's talked to us about yet, but the ability to live stream our games, to fans that may not be that maybe we would end up in a situation where only we would have family members at the games. But I'm telling you, there's lots and lots that need to still be done, but you got to have a plan. You got to believe that you're going to be able to go there and know this situation is so fluid and it can change, and it changes very, very, very quickly. Today, we couldn't do it, but we got to have a plan, and we got to have a hope and a dream that we're going to be able to do it. But I'll pass now to Bernie.
Thanks, Governor. I do think that if it were today, we'd have a difficult time. 2 to 3 weeks ago, we were looking at it, and we're looking at numbers, and I'm talking to my counterparts in all the other connecting states, and I'm telling them our numbers are good. We're going to hit this. We'll be able to start August 3rd, But as we've watched the numbers, they've continued to grow. I think what we're here to do today is emphasize we need to do our part to stop this. The ball is small right now, but as that ball rolls, it's going to get out of control and hard to handle. So we have an opportunity right now with the masks to be able to control that. We do have things in place for social distancing. We've put limitations on football that you can't do. The linemen can't be up face to face with each other. We've kept you within your school. You can only do inter-school activities at this point. I think the advantage we have over college and pros is we're all in our community. Your school is your community, so it's almost like your family. And so you can keep control of that little unit. And that's what we're trying to do as we move forward. So if it were today, it would be a very difficult call. As the governor said, we've been talking. We have the capabilities to do live streaming at almost all of our events right now. And we can extend that and work with our schools to make sure if it is fans only or family or teams only, certainly we'll be able to do that. So, we want everybody to do their part.
All right, thank you, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi, David Beard. Regarding Mon County is the state hotspot at the moment. We're looking at people hitting the bars and restaurants tonight and through the weekend. So I'm wondering if you might expecting maybe to have a decision on closing things down again by Monday, or what kind of timeline you're looking at as you get the input from the numbers.
David, it is a really, really tough call, as many of these decisions have already been. I'm well aware of the fact that, parts of life that we want to enjoy, going out to a restaurant or those that are going to bars and everything, and more importantly than that, the restaurant owners or the bar owners or, the businesses, and how they impact all the employees that work there and their families. And I get it. I absolutely get it. If our numbers continue over the weekend in a negative way, we're going to have to move in Mon County to shut down our bars and restaurants, our in dining, in Mon County. If they begin to, or they flatten some and they begin to ease back, Monday will be a big day. And so, David, I'm not ready yet to do that and impose that level of additional hardship, but at the same time, we know the situation and how critical the situation is, and we're not going to let it get to a point in time where it just gets out of control. And we also know that, with kids coming back and everything, we've got to stop this and got to stop this now, or we're not going to be able to end up with kids back at West Virginia University. And so there's just there's lots and lots of repercussions. And David, we're doing the best with it we possibly can do.
All right, thank you, David. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. This question deals with the real possibility that at some point in the season that there's going to be a team that has a member of the team test positive. At that point, does the whole team go into quarantine? Do games get canceled? How is that being handled?
Certainly, at this point, we're looking at that. In football, you have two different ways a game doesn't get played. It's a forfeit or it's a no contest. If the team is shut down, then it would be a no contest and there would not be implications. So we expect that it's possible that there'll be places and times and people will miss a game or two as we move forward. So we don't think that we're going to live in a bubble. Whatever's going on in the community is certainly what's going on at our schools. So we think that there'll be times that some teams will have to sit down.
All right, thank you, Paul. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. I want to jump off of David Beard's question and note that a lot of bars and restaurants here in Morgantown preemptively closed over the weekend. With that being said, does decisions by businesses being proactive in this, does that play any role or motivate you in any particular way about, going ahead and making these closures?
I would answer, sure it does. If we see people that are closing voluntarily, it just absolutely gives us more information that we can process and say, we see what's happening. We see what's happening there from the standpoint of all of our numbers. We see what's happening there on the ground from the standpoint of our health departments and all the input that we're getting there. But we also see and we listen to what's happening right at the shop, right at the start spot. And if we see that and everything, it will absolutely move us more in that direction. So we're trying to process all the information we possibly can and make an absolute decision that's going to keep us as safe. And remember this, everyone remember one thing. What are we trying to do? We're trying to manage the risk. We know this disease and killer is right here, right now. We all know that. And what are we trying to do? We are trying to manage the economic aspect, the absolute emotional and mental and physical aspects of everything, and manage the risk as best we possibly can. At the end of the day, all we're doing is trying to get ourselves to the vaccine. That's all we're doing. We're just trying to push ourselves along and get ourselves to the vaccine. It's been since Monday since we lost somebody. Every day means something because every day we're getting closer to the vaccine. If we can just listen and just bridge ourselves individually long enough to get to the vaccine, we'll be okay. In a movie long ago, Tom Hanks was sitting on an island where his plane had crashed, a FedEx plane crashed. And he said the only thing he could tell himself was keep breathing and something will wash up in the tide. Well, in our situation today, we got to keep breathing. We've got to maintain ourselves and keep ourselves until the tide washes us that vaccine. That vaccine's coming. It's not very far away. The inconvenience of a mask is nothing. It's nothing. And absolutely, but we've got to absolutely know that managing the risk is exactly what we're trying to do.
All right, thank you, Dave. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I just want to get some clarification on businesses, licenses being pulled and or potentially businesses being shut down. Can you talk about under what guidelines that would necessarily happen, under whose jurisdiction, and if the mandate for people wearing a face covering in public would have anything to do with an actual shutdown, or would that be a shutdown underneath the guidelines that were set out for reopening?
Amanda, I don't know of any business that's been shut down. You know, one of the things that we're going to probably recommend today is that all businesses put up a notice on the outside of the business, you know, that mandatory mask, you know, that there's an executive order demanding mandatory mask. We have to have the businesses, we have to have them kind of be our eyes and ears on the ground and everything. However, you know, right at this point in time, we don't have any fines in place or any shutdowns in place or anything like that in place right today. And so all we're again asking, you know, is our businesses that if you don't feel comfortable serving someone that's saying, I'm not coming in there without a mask and everything, then turn them away. That's all there is to it. You know, but our businesses need to be the eyes and ears. But from the standpoint of our, you know, one other thing I should add is our health departments can suspend their license, you know, and if we get into a situation to where, you know, our health departments, and we're going to lean on them from the standpoint of letting them make the right calls, and if they think a business is exposing others and everything, and they're becoming a health hazard and everything, they can suspend that license. But nevertheless, I've got a lot of faith in West Virginians, and you know, I want to say something else about what Bernie Dolan has said to us over and over. You know, I commend Bernie for having, and everyone at the SSAC having a plan, but you know, he takes it to another level here when he says that basically what we're basically doing is we're also telling everyone of how important it is that they do their part so that we can have a plan. You know, so, you know, an aspect that really I hadn't thought of and everything, and I congratulate him. It's a great thought. And so for all those that are out there, maybe there's somebody out there that's, you know, that says, well, I don't have to wear a mask and everything else, but that person that may be saying that loves football or loves soccer or whatever like that, and he wants to see that be a part, or maybe they love just the academics or getting their kids back in school and all that. And so basically what they need to do is get themselves all hooded up with their mask and join all of us and everything. You know, misery loves a little bit of company, and I know the masks are a misery to a lot of people, so let's all wear them.
All right, thank you, Amanda. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis from Nexstar, Governor and cabinet members. And let me weigh in and say congratulations, Dr. Ayn Amjad, who's been a great media source on public health issues for years in the state. We all look forward to working with you. Governor, I want to circle back to Steve Adams' question about a special session. I realize you may have sole authority based on the federal guidelines to distribute the CARES Act money without the legislature. But if you're talking about fines or penalties or some kind of sanctions on the mask wearing, if it comes to that, wouldn't the legislature have to be called in and pass a law? I don't think you could deal with that unilaterally.
Mark, you're exactly right. 100% right. You know, that would not fall in my bailiwick in any way. The legislature would have to come back in. We would have to pass a law and everything. Absolutely, without any question whatsoever. I wouldn't hesitate, you know, for a second. If I feel like that we get to that point in time, they'll have to be brought back in. That is no power of mine whatsoever.
All right, thank you, Mark. We have time for one more. We'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Yesterday, the World Health Organization acknowledged that the coronavirus may be partially airborne, meaning the particles that we're all trying to avoid can hang in the air. Given that, do you think we need to expand the mask mandate to, you know, when we're in our office settings, that we still need to be wearing them? Do we need to reconsider what we know about mask wearing given this development?
Charles, I'm going to defer to Dr. Marsh and let Dr. Marsh or Dr. Amjad, you know, this may be an opportunity for Dr. Amjad to weigh in, but today, I think, you know, again, I was watching the numbers and being able to social distance and everything, and I think we're okay, but I'll defer to our experts on that.
So maybe I'll start and then I'll throw it over to you if that's okay. Good. So I appreciate the question. I think that as the governor has pointed out, we are right now at a very critical moment for the future of what we want to do related to schools getting back in session, sports, maintaining our ability to keep our businesses open, and most importantly, protecting our vulnerable citizens, protecting the people that we love in our communities, and making sure that our healthcare systems don't get overwhelmed by a surge. So I would just say that it's clear, at least in my assessment, that wearing masks, if 80% or more, and the governor has called for 99.9%, which I'd be 1,000,000% supportive of personally, if we can get people to wear masks, that physical distancing works in concert with masks. We know that if you're outside and you're physically distanced, then that's much better because of the ability of the atmosphere to disperse the particles. But as you're suggesting, I think it is clear that person-to-person spread happens by droplets and perhaps by aerosolization of some of the COVID particles, which is the reason why we want people to wear masks, to reduce that amount of production from people who may not know that they are infected. So if you're in an office by yourself with the door shut, could you take your mask off? Of course you could. But if you're around other people, even in the vicinity with the door open, it's probably a safe bet to keep your mask on, even when you can socially distance or physically distance, particularly right now when we're at such a critical juncture in the state and where our T value, that reproductive score, has gone up so high. So I now will defer the rest of any thoughts to you.
Thanks, Dr. Marsh. Charles, going off of what Dr. Marsh said, in my office in Beckley, I have 5 staff, and when we're within shoulder-to-shoulder distance of each other talking about something on the computer or a piece of paper, we tend to put our masks up. Otherwise, we've actually moved our desks so that we are more than 6 feet apart. Otherwise, our stations were very close together. But my staff, if we are more than arm's length away, we put our masks up for the same reason that Dr. Marsh just mentioned, saying that it is, maybe particle spread of what you're referring to, of aerosolized particles. So going off of that, what he's saying is we were practicing this way before the World Health Organization said anything, way before this was mentioned, because we don't know what the spread is. So if you're going to be in the building with somebody, you are going to have socially distancing yourself, just the way we are sitting here, Secretary Crouch and I. But if you're going to be shoulder to shoulder or more than arm's length, you should put your mask up. That's how we're practicing even in my office, me and my staff, because you don't know if you're going to accidentally sneeze or cough or anything. But you just practice social distancing, or if you're far apart, you can take your mask down, just the way we've been sitting in our offices. But you don't know right now because data does change every day, but that's how we also been practicing in my office for the last 4 months. So that's what I would recommend. If you're not far apart, you should put your mask up if you're going to be talking to someone. Otherwise, if you're apart, you can put your mask down. That's how we've been practicing.
All right, thank you, Charles. Governor, I'll turn it back to you.
Well, I've got one. We've gotten in a request about our bans, and I want anyone that's asking a question about bans. Our bans fall under our Department of Ed, and I'll just follow up and make sure that guidelines are up in regard to our bans. Is that correct, Bern? And I'll follow up with Clayton, and I'll speak also with Bernie, in just a second about that. So we'll have more guidelines and more stuff up about that, later today if it's not already up. And again, let me just say this. So often, as I'm going down and thanking people, whether I on a particular day may say, our healthcare workers, or on a particular day I may say our first responders, or the EMS or, DHHR or the National Guard. Or I may say over and over what an incredible job that our local health departments have done. I want everyone to know, and whether it be our police or firemen or whomever, our first responders in every way, I want everyone to know that all of those people, if I mention the National Guard or I mention DHHR, I'm mentioning all of you that are on the front lines. And I may have even missed somebody today, and if I did, please forgive me. But I can't go through everybody all the time, but I can tell you, you know who you are. You know the ones that you are on our front lines. You have made us be the miracle. And so as we're the miracle, please, please, please continue to be the miracle in every way. I commend you and I thank you, for our county emergency managers, it just goes on and on and on, but thanks so much for all of us. And I'll close by saying this. Again, I go back to Dr. Amjad. What an incredible find, and we are so, so proud to have her. I appreciate Mark Curtis mentioning all her public service announcements, all the different things that she's done for community in West Virginia. She is absolutely committed to being a great servant and a great, great, great West Virginian. So again, Dr. Amjad, thank you so much for coming on board and being that great servant to this wonderful, wonderful state and all of its great people. So thank you again.